as you may or may not be aware, local Long Island, we had an insurance carrier called the CareConnect, was owned by the North Shore LHA Health Care System, right? Actually, it was a great program, you know, for those that maybe lived in Nassau County, northern Nassau County, because it had the North Shore LHA Health System, which was great. They're non-renewing groups effective December 1st. So just so that you're aware. If you had a group prior, they're renewed. If you have a November group, they're going to renew until 2018. However, December 1st groups are not renewing. Very important. Now, a couple of things to be aware of. CareConnect, at least relative to the health insurance, is one of the few companies, or only companies, that did not require participation requirements. So if I was a small business, hypothetically, maybe I had 15 employees and only 3 employees were going to go on and nobody else was taking it, CareConnect would take it. Most other insurance carriers, and I'm going to say Oxford for the most part, because Oxford probably has 75% of the market share in New York, they do have participation requirements. Okay, very important. So all I'm sharing with you is if you have clients that are in CareConnect, there may be issues come December 1st when they're looking for coverage to go to other carriers. It's the only point I want to share with you. Now there may be ways to do it, and we might be able to help you with that, but you need to be aware of that. Very important. Also, another important item I want to share, which is extremely important, specifically to the participation requirements. Some of you may or may not be aware of this, but don't forget, in accordance with the Affordable Care Act, between November 15th and December 15th is a federal open enrollment period relative to small group coverage with insurance carriers. Meaning, if I've got a group that has 20 employees, and I'm only going to have 3 people enroll, and the other people don't want it for whatever reason. If I enroll or set up the group between November 15th and December 15th for a January 1st effective date, it's the only time of year the insurance carrier cannot impose participation requirements, which is huge, which is huge. We have a manufacturing company in Queens, 90 employees. We have to provide health coverage to the employees based upon an affordable basis, 9.66% of the W-2 wages, all of that kind of good stuff. All right. We did the open enrollment last year. 1 person took it, right? Because the plan that's being offered is a high deductible and it's very expensive. That's going to happen this year. We have to do the open enrollment period between November 15th and September 15th. That's the plan for that 1 person to enroll. That's what we're sharing with you. You got to be aware of that. Okay.